welcome to this aspect of the Tkm program 2025, which is going to deal with men's health. So I'll be giving a health talk on men's health. This few minutes, if you permit me, we're going to spend a few minutes looking at the general health, in particular as related to men. The purpose of this talk is to enlighten and reawaken our awareness and steps to take to ensure that men take care of their health. It is not going to be academic. As much as possible, we want to simplify it so that we all can be carried along. Thank you very much as you listen. Good morning. Now, talking about, we're going to look at the health generally. We'll go along this line. There will be introduction to the general health. Then we'll look at what are the warning signs that points to issues of health challenges. And then we're going to look at what we need to do in regular checkups to ensure that our health is maintained. And then we look at nutrition and exercise, which is another important aspect of keeping fit and remaining healthy. Then we'll now go on and select two specific, very common diseases that is ravaging the entire health system, and that is hypertension and diabetes. And then we look at specifically two areas that are found very common among men, specifically prostate health, and then we look at erectile dysfunction. And we now round up with stress management and work-life balance. Now, by way of introduction, I want to quote from 3 John 1:3, which says, "Beloved, I wish above all things that thou may prosper and be in health, even as thy soul prospereth." That shows that God actually desires us to be healthy. So in this health talk, as I said earlier on, we shall try to be as simple as possible and as non-academic as possible. We shall discuss few common diseases that affect human beings. Men, we have found, are the most vulnerable group of humans on earth as regards health challenges. You agree with me, because men takes so much risk on a daily basis. They take more risks in trying to fend for the family. They are generally regarded as the breadwinners of the homes, and so sometimes they go extra miles to meet up this responsibility. You also agree with me that most men hardly bother about their own health. Rather, they are more concerned about the health of their families, their children, the wife, and all that. And of course, you also know that men do all the dangerous jobs on earth: driving, biking, working at construction sites, working at very odd hours, such as security guards and all that. They are the ones that go to war front, and many more things that men do that makes them predisposed to health challenges. And in looking at some issues about men falling into sudden death, we have seen a lot of heard, and I'm sure many of you have had people who are close to you that suddenly collapse and die. Some of them, well, may have survived. Most times the causes are not detected. But I have come to realize, and interacting with some of my colleagues, that the most common thing that kills men is not really the illness itself, but the attitude towards the illness. So 3 areas that men often become nonchalant. And this is in a health condition. One is the poorly managed health condition. Most of them, of the chronic diseases, are poorly managed, not seeing the right person, the right physician, or the right healthcare giver. We also noted that a lot of underlying diseases are not detected. So undetected underlying diseases are causes of sudden death. And then, of course, we have those ignored warning signs. Some people, ignorantly, I say, they ignore warning signs. We have signs that shows that, there's a problem. They don't bother, either due to ignorance or just not nonchalant. So let's look at some of these warning signs or underlying that points to underlying diseases. Some of them you know. I'll just mention them for the sake of enlightening, bringing us to understand some of these things. One is persistent headache. Quite a number of people have persistent headache and they just ignore it. Some others include lethargy. Lethargy means weakness of the body, you just feel lazy, you just not yourself. These are warning signs that something sinister may be on the way. Insomnia, or what we call lack of sleep. People found that they can't sleep. Wake up midnight, you can't get sleep again. You find it difficult to go to sleep. And when it persists for a long time and you don't even have a reason for it, please go and do your checkup. And then you have unusual weight loss. There are people that begin to lose weight. We are not on chronic fasting, we are not dieting, and you begin to lose weight. Go for checkup. And of course, you can find that a number of people are restless. You just find that you are restless, you sweat, you just can't be calm. Something is wrong. There are some diseases that could be the cause for that. Then unexplained pains, pains in areas that some people have chest pain, some people have, some loin pains, and the pains are there, but sometimes we ignore it. These are called constitutional symptoms because they don't actually point to specific disease, but they appear. When they appear, we should go for checkup. Now, what regular checkup should we do? Men should go for medical checkups at least once or twice a year, especially from the age of 40 and above. The older you get, the more important it is to monitor your health regularly. And the key areas you can easily check up anywhere. Your blood pressure. This one you can do at home, you can do by in a nearby chemist, you can do. So it is very important. And then of course the next one is your blood sugar. Blood sugar level you should check as regularly as possible. Then there's what we call the lipid profile, the cholesterol, triglycerides. This shows the fats in your body. Please do well to check regularly. Then your kidney functions. The kidney is a very important aspect of the body, of an organ that need to be monitored. Then the liver function. So as we go along, we highlight more on these ones. Now, another thing we must look at when you talk about health and staying healthy is the kind of thing you eat. The Bible says in 1 Corinthians chapter 10 verse 23 that we are allowed to do anything we want to do, but not everything is good for us to do. So if you bring back to nutrition, you are free to eat anything you want to eat, but not everything is good for your health. In terms of food, we can say what is good for the geese may not always be good for the gander. So choose wisely what goes with your system and eat everything in moderation. As a man gets older, of course, he should cut down certain food, especially sugar, fat and oils, carbohydrates, processed foods, including carbonated drinks, alcohol consumption, caffeinated drinks, and related drinks. The red meat should be put on the lower side, and consume more fruits and vegetables. This will give you a healthy eating, a healthy body. Now, when you eat, you must also consider your time. Timing when it's important. Avoid late night food, especially heavy meals, because when you eat late, a lot of the food is not digested, and they are stored, and they cause overweight. Another very important aspect of maintaining your health, which is very, very good for every age, is exercise. Exercise is considered a major aspect of what keeps you healthy. In doing exercise, it is age-related, age-appropriate exercise. It range from brisk walks to jogging, playing table tennis, or to those who can afford it, a treadmill for indoor exercise. Every form of exercise is important. And then it is expected that a minimum of 150 minutes of exercise in a week will help a lot. You can spread it over the 7 days. And of course, in doing an exercise, I want to say here that you can only, say you have done an exercise, when you feel that after doing it, there's a change in your heart rate. You see yourself panting. You may sweat, you may not sweat, but your heart rate must increase. We always say that the heart rate should increase up to 120, almost doubling the size, the speed. So that is an evidence that you have done an exercise. Of course, there are other beneficial form of exercise they call yoga, which also improves flexibility and focus. Exercise generally play a key role in preventing and reducing effect of diseases such as diabetes, hypertension, and depression, and quite a number of others. It also helps with weight control, better sleep, alertness, and reducing the risk of high cholesterol. Overall, it boosts your metabolism. That is, ability helping your body to digest food and eliminate waste more efficiently. Now, having said this, for time's sake, we just go and discuss a few things about hypertension and diabetes. Data available to me as of 2024 is been estimated about 2,988,500 adults in Nigeria were diabetic. And of course, as for hypertension, the figure I have here shows that about 27.5 million people above the age of 20 in Nigeria were said to have hypertension. These figures may no longer be realistic. We do know that with the situation in the country today, more and more people are getting hypertension. Hypertension is popularly known as a silent killer. From a simple analysis during our outreach in Ampa and Southern Kaduna, when we went for mission aid, I took a particular notice of how common the hypertension was in the places where I worked. I had analyzed 40% and more of patients that came for just simple treatment. When we checked their BP, they were hypertensive. And most of them never knew, and they were never told that they were hypertensive. And if those people collapsed suddenly, they will attribute it to witchcraft. Hypertension often comes without symptoms, which is why it is called the silent killer. However, there are people that may experience some signs, such as persistent headache, restlessness, poor sleep, occasional dizziness, and some of them have dull pain in the lung areas, in the renal angles, and of course a number of more of these symptoms occur. And when you begin to experience unexplained signs, please go for checkup. Check your BP. The normal blood pressure is said to be 90/60 on the lowest side, 139/89 on the maximum side. Of course, that means the systolic, which is the top one, is between 90 and 139. It can be considered to be normal. The diastolic, which is the lower one, 60 to 89. Now, once your BP begins to hit 140/90, you can be said to be hypertensive. If your regular BP is usually a low one, some people 100, 110/70/80, 120, and you begin to see your BP rising to 130, don't ignore it. That could be an early warning sign that you're about to become hypertensive. And of course, the earlier you nick it, the better. Because when you allow the BP to continue to rise and become high, it begins to destroy a number of things in your body. That's why it's good to keep it low. I have heard people say they were hypertensive, or they once told them that their BP was high, so they were treated, and then everything went normal. And they never check up. The next time you are seeing them, they had collapsed. Please, let's do a checkup regularly. Even if it is high, normal. If it is normal, keep checking. Now, let's look at briefly the issue of diabetes. Diabetes is often asymptomatic in its early stages. Asymptomatic means you don't feel any sign, you don't see any symptom. But when the blood sugar begins to rise, and then the symptoms begin to show, like excessive thirst, frequent urination, this is when the kidney can no longer contain the level of the sugar that is flowing to it, and unexplained weight loss, sugar in the urine, okay, and quite a number of other symptoms. Of course, because diabetes is a multi-systemic disease, other systems begin to complain. The normal blood sugar should be between 3.5 to 6.0 millimole per liter. Of course, it's equivalent to 63 to 108 milligram per deciliter. So, like I said, diabetes is a multi-systemic disease. It affects both the nervous system, that's your brain, and the nerves, the circulatory system, that is the heart and the blood vessels, the cardiovascular, specific organs like the eyes get damaged. You begin to see cloudy. Your vision begin to reduce. The liver can become fatty. The heart and kidneys over time gets involved, particularly the kidneys. Diabetes can cause kidney failure. Now, today, younger people are becoming diabetic. Even as young as 9 years have been found to have diabetes. Now, I think these are due to certain consumption of foods. A lot of refined food we eat these days. And of course, the lifestyle we live. Now, refined foods, sugary drinks, processed snacks, and lack of physical activity like walking, playing, are major contributors to the increase in incidence of diabetes. Because of the limited time, we just go ahead and talk about two specific things that affect men: prostate health and erectile dysfunction and stress are what we're going to look at in the next few minutes. Now, the prostate is a small gland under the bladder that helps produce semen. It is the one that produces the liquid sperm stream through to get to their destination. Now, the prostate grows with age and can affect urination and sexual function as it enlarges. What are the common prostate issues that we see? The enlargement of the prostate, called benign prostatic hyperplasia, BPH. This one is non-cancerous enlargement of the prostate. The symptoms include frequent urination, weak urine flow, dripping of urine when after the urine should have stopped, incomplete emptying sensation. You are finished urinating, you go back to your bed, you still feel that the urine is not finished. Of course, there are other issues that cause that, like cystitis and all that. The treatment of benign prostatic hypertrophy could be medications, lifestyle changes, surgery if necessary, if severe. The medication will help to keep the urine flowing well. It may not totally, remove this BPH. Most times, once you start taking medication, you take it for life. Other things that are common with prostate is prostatitis. This one is just an infection of the prostate, which with antibiotic can be treated and it will be over. Prostatitis will present as difficulty urinating, painful urination, frequent urination, just like BPH. Like I said, antibiotic will take care of that quickly. Now, the worst of it all is the prostate cancer, which of recent is on the increase. and is one of the common cancers in men. Symptoms are similar to the one found in BPH, that benign prostatic hyperplasia, but in addition, one may experience bloody ejaculation. I've seen quite a number of men who have come to say, "Oh, I noticed that when I ejaculate, there's blood, and that's a sign you must go quickly to do a check." The risk of prostatic cancer increases with age, especially after the age of 50, and with a family history of prostate cancer. And it often shows no symptoms in the early stages, which makes screening very, very essential. Now, the recommended screening tests for prostate cancer are PSA, prostatic specific antigen. When you do that, the usual normal range is from 0 to 4, and then when you begin to get above 4, up to 10. Sometimes when they present, we just try to treat with antibiotics and see, because when there's infection and inflammation, it may also rise. But it is essential that you go for this test and be sure. The physician may do what we call the digital rectal examination, which you will be able to find out, is your prostate hard? Is it smooth? Is there a rough area around that? Is there the structure? Is it consistent with what is normal? Now, we can also do ultrasound and other MRI and all the rest to detect if there's cancerous changes. But the most specific test is to do a biopsy, where you take a small tissue of the prostate and send it for histology report. Okay, so if detected early, treatment may be very good. Options may include surgery, radiation, hormonal therapy, depending on the stage and the health condition of the patient, and of course the age. Early detection saves lives. Don't skip your yearly prostate check. Having said this, we want to also look at one of the disturbing issues, and that's erectile dysfunction. I can tell you that this is on the rise in recent times. Even at younger age, people are coming down with erectile dysfunction. Erectile dysfunction is the inability to get or maintain an erection firm enough for sexual activity. It is a sensitive but very common issue, and often signals an underlying health problems. Now, what are the causes? Now, I'll look at the physical causes: heart disease, high blood pressure, diabetes, obesity. This condition affects blood flow essentially to several parts of the body in the penile area, which is required to gain strong erection. There are other factors. Number 2, lifestyle factors. Now, lifestyle factors may include smoking. A lot of people who smoke, well, most of you will not belong to this. Excessive alcohol consumption, this may not be what we should look at here. Lack of regular exercise, I think this is where some of us are guilty. Heavy meals late at night, again, this is where I know quite a number of us are practicing, especially those who work late and come back and they need to eat. And then some late night eating when you eat and your tummy is full, your blood is diverted into your gut to help digestion, so you won't get enough blood flowing to the phallus. Now, masturbation is a habit that can become a problem in adults when you are married, because you might not be having erectile failure. Now, number 3, psychological factors. I think 90% of erectile dysfunction come under psychological factors. This may come in form of stress, especially work or financial stress. It can come in form of anxiety, so you're anxious about an issue. Sometimes low self-esteem can cause erectile dysfunction. Depression of any kind may result in erectile dysfunction. Other factors can come in, like medications. Some of people are on certain medication can cause erectile dysfunction. Drugs used for hypertension, depression, chronic illnesses can reduce sexual performance. Now, environment may be uncomfortable for couples to enjoy sexual activities, so the environment can be unsuitable. There's what I call monotony. This one has to do with the couple should explore other ways of trying to, spice their love activities, their sexual affairs, not just maintaining one position, or must it just be in the night when the light are off, must it just be, change environment, change styles. It might help a lot. Now, we can also have relationship stress as a cause. Sometimes negative behavior from your spouse, like constant nagging, unrealistic pressure or expectation from a spouse. This can create emotional tension affecting intimacy. Every man, one way or the other, will have erectile dysfunction, erectile failure, one way or the other. And the worst thing is for the woman to begin to complain, so that may have a double negative effect on the man. And so let our women please, know how to handle it. Now, we also have issues like poor hygiene from the spouse. A lot of spouses that are women that don't maintain good hygiene may not, help the man in having the attraction and the interest. So low interest from the spouse is also another factor. Erectile dysfunction is treatable. Don't suffer in silence. Speak out. Seek medical advice so that we can address the root cause. There are a few treatment options, of course: exercise, weight loss if you are obese, stop smoking, alcohol consumption, substance abuse. All this one, if you remove, can be of a great help. We have medications like Viagra, the Cialis. Well, these are not recommended for those who have some underlying conditions such as blood pressure, and those who are above 60 years of age. They must run away from it. Most important is counseling. We can counsel people, we can suggest various ways to handle it. Stress, psychological causes can be handled by mere counseling. Now, also advocate advice for change of environment, take a vacation, go out with your spouse, your wife, have a good time. and then you see yourself coming back strong. Other treatment may not be very common, vacuum pump, injections, or surgery for those who have pathological conditions. How do you prevent this? Keep your blood pressure low, keep your sugar level low. Very important when it comes to sugar level. Those who are diabetic, please maintain a low blood sugar at all times. Take your drugs, because diabetes have a way of causing end nerve damage and vessels, damage to vessels and nerves, and that can cause the most permanent erectile failure. And keep your weight under control. Manage stress. Maintain a healthy relationship. Regular exercise and a healthy diet. Going on holidays and tours. Maintain good work-life balance. Smile a lot. Be happy with yourself and your family. Now, finally, we want to talk briefly on stress management. Quickly, stress is your body's natural response to pressure, but when it becomes constant, it starts to affect your health, mood, and performance. Now, what is the effect of stress on men? The stress on men can cause high blood pressure, poor sleep and fatigue, anxiety or depression. It can cause headache, muscle pain. Stress can reduce your sexual performance. Of course, we have seen it before. Increased risk of heart disease, poor output at work, and wrong judgment. Agitation and irritability, forgetfulness are those effects that stress can cause. Now, work-related pressure, financial responsibility, family expectations, health challenges, lack of rest or leisure, or emotional suppression are other common causes of stress. What are the healthy ways to manage stress? First and foremost is prioritize rest. Most people that come down with stress, they have failed to know that rest is part of what they should build into their work schedule. Even God rested after creation to show us an example. Please take time to slow down and recharge. You will do better. The recommended hour of sleep is about 7 to 8 hours per day. Most of us don't even do 5 hours. So please take out time. Take a nap in the afternoon. A nap can restore your energy so fast. Set boundaries. Know when to say no and protect your mental space. Now stay active. Exercise helps relieve tension and improve mood. Now talk to somebody. Talk to a friend. Talk to a pastor. Talk to a counselor when you are finding it difficult to unwind. Talk to a doctor. Don't keep it to yourself. What are those things that are stressing you? Excuse me. Do a lot of socialization. Meet old classmates. Get together. Do a family get together. Smile. Talk to people. And then socialize. Do a few things. Attend ceremonies. Marriage ceremonies and all that. You meet new friends. Maintain fellowship with God. This is very important. Of course, I don't have to overweight this. We are looking at ourselves as Christians and Kingsmen. Prayer, meditation, worship bring peace to the soul. Eat healthy and sleep well, my dear. Your body needs proper fuel and downtime to cope with stress. Now, work-life balance. Don't bring work stress home. Separate spaces if possible. Make out time for your wife. Make out time for your children and the entire family. They are your first ministry. Take time off to rest or retreat. It is not laziness, it is wisdom. Plan your day. Having structure reduces pressure. Plan your day. This time I will use it for this time, and this time I will use it for my exercise. Engage in a hobby, maybe table tennis, indoor game, and whatever. Something you enjoy outside work. It will help you a lot. Balance is not about doing everything. It's about doing the right thing in the right proportion. In conclusion, my dear brothers, and if there are sisters, your body is not yours. It was paid for with a price. For God said in 1 Corinthians chapter 6 verse 20, for God bought you with a high price, so you must honor God with your body. A price too hard for you to treat your health carelessly. Take out time to take care of your health. It's not just for your family or your career. It is an act of worship, a way to honor God. Go for that checkup, my dear. Eat to nourish yourself, not just to fill up your tummy. Rest well, exercise, and manage stress. Don't ignore warning signs. Above all, put a smile on your face. It helps a lot. Live wisely, my dear. Live purposefully, and live healthy. God bless you, and thank you. Once again, I'm Dr. Stephen Moro, your very dear brother. Thank you for listening.